Hello everybody, welcome back to Daytime York Region. Shawn Solomon is here and she's the owner of Thornhill Skin Clinic in Thornhill. And this is a great topic because a lot of women and men are looking to improve their looks in a non-invasive way. Shawn, I mean, your skin clinic offers absolutely everything. You can lift, you can tone, you can get rid of lines. It's like a miracle place, isn't it?
I mean, I don't know that I'd call it a miracle, but I think that it's a remarkable time that we can now use non-invasive measures to treat some of the things that bother us with aging.
Absolutely.
I don't know too many people who like to age. I can say, for one, I'm our best customer. You know, I'm 41 years old, I have 4 children, and it really matters to me how I appear on the outside.
Wow.
And people think it's just my business, but it's not. It's the passion of the business. So we do have so many modalities now, from, you know, neuromodulators like Botox and Dysport and Xeomin for fine lines and wrinkles, volume fillers like hyaluronic acid for filling up, you know, lost volume in the cheek area, nasal labia folds. Some people want bigger lips. We can restructure jaw lines. We can even improve a bump on the nose with fillers nowadays.
Wow.
You know, brown spot pigmentation, red marks on the skin that come from elemental exposure, from being outside too much, from pregnancy, from all different things that we can't always control. We can remove those things with photo rejuvenation.
Isn't that
so,
nice?
Yeah.
So does the client come to you with a concern and you recommend a course of action through your treatment?
Yeah. We do a free consultation for every person, whether they've booked a specific treatment or not.
Okay.
So generally what happens, someone comes in with a concern and they bring to me what they want me to do. And a lot of the time I'll vet that and sort of make suggestions about how I think I can better treat the indication.
Right.
You know?
Now, we have a lovely model here, Mary.
Yes.
And today we are featuring a great product that you have, or service,
Yes.
or therapy.
Yes.
Called Ultherapy.
That's right.
What does it do?
So Ultherapy is an ultrasound that uses sound waves in order to tighten, firm, and lift the skin. Now, I emphasize lift because it's the first FDA-approved treatment for actual lifting of the tissue.
Okay.
What happens to our skin as we start to age is we start to lose collagen. We lose about 1 to 2% of this collagen a year, starting in our 20s. And so we can see where our aging process could sometimes take over. By that, protein in our collagen lattice work breaks down superficially, showing us fine lines and wrinkles, and deeper in the connective tissues to make us prone to gravitational changes like sagging, falling.
Oh, I hate those gravitational changes.
We all do.
Yeah.
So by delivering ultrasound into the deeper layers of the tissue, we are able to create a lift factor, a tightening, and a firming of the skin all at the same time. And it is quite remarkable. I mean, we see differences the day that it's done, but these differences get better upwards of 6 months post-procedure. And we're reaching levels that are achieved in surgical procedures.
And now you are going to show us kind of how it works on Mary. And I think this is nice because this is the first time that you haven't had to go under the knife for that lifted appearance.
Well, Mary is, the reason I like to bring Mary with me is she's a good friend, a great client, but I don't know how many of you would believe looking at her if you can see on the camera. She's 47 years old.
No, she's not.
She is.
Mary. You're
Mary,
beautiful.
I want to tell you I've done tons of things to her to make myself feel better about it, but I haven't. She is genetically inclined, which is important, but she's also really, really big on taking care of herself. She takes care of her skin. She submits to modified treatments in order to maintain her aging process on a reasonable level, and really prevention is key, okay? So right now what I'm going to do, we're going to do sort of a modified version of an eye lift because I don't think we have enough time to do the whole thing. But it's a pretty neat thing that I'm going to be able to show you, that this is not a blind procedure. I get to see exactly where I'm treating, and there's no other technology out there that allows me to do that. So using the sound waves, I'm going to deliver pretty deeply into the skin.
Mary, can you turn your head even more to the left?
Yeah, and
perfect.
That's going to help me
Thank
too. So what you see here, this is a transducer. This transducer is actually delivering the energy, and they're called thermocoagulation points, really deep into the tissue in order to create tightening and almost a coagulation of the tissue, replace that weakened collagen with stronger collagen.
Okay, let's see it.
All right.
And again, is she feeling anything as you're doing this?
She is going to feel this.
Okay.
So I'm looking for my picture. If you can see on that picture, see that white line across the bottom?
Yep.
That's a bone. Okay, so we're going to stay away from that.
Oh, wow.
And then the rest you're seeing is fibrous tissue, dermis, and epidermis. So that's a perfect picture, and we're going to deliver. And here we go,
So
Mary.
you're delivering the treatment.
I am. We don't need goggles because we're not using laser.
Right. And now how many times would somebody have to do this treatment in order to see the results that they want? Or does it depend on the patient?
Well, this treatment really is a one-time treatment. We can customize it. That one's going to hurt a little bit. We can customize it and regenerate collagen from a prevention standpoint. So Mary might have this treatment today and get a fantastic response to the treatment, and a year from now use it for touching up. So we're just going to rebuild that collagen. As we said, we're losing 1 to 2% of our collagen a year. So regenerating new collagen in that fibrous tissue is always a plus.
Now, who is the perfect candidate for something like this?
Really, anybody.
Yeah.
I mean, I'm showing you the eyes, but the most amazing and remarkable area that people are really excited about right now is under the chin.
I was going to say that neck area that doesn't seem to tighten up.
It is a huge area. I've had it done, I have to tell you, and it was very addicting. After having my twins, I felt like the whole shape of my face changed, and it was almost an instantaneous response. So love that. We can do the jawline, we can do the clavicle. Wow. We now can do the entire chest area to create a 1-inch lift on the bust area. On the eyes, what I'm doing now is we can create 1.8 of an inch lift
in her skin
above the lid.
Oh my goodness.
So
even if you want kind of a higher brow,
that's
right?
exactly it.
It can give that effect as well.
Exactly, as well as tightening that sort of periorbital skin. As well as we're using it a ton right now under the eyes for people who have fat pads under the eyes. We can actually pull out some of the water in there and flatten that look under the eyes, as well as tightening the tissue there. We're able to use it on the sides of the eyes for tightening in the tissue around the eyes. We're using it on the mandible right through here to bring back the skin into its skeleton where it used to be. We're using it obviously under here, all the way down the full neck, the clavicle. R&D is now showing we're going to start being able to use it on arms, legs.
Oh,
yeah,
I love that.
it's remarkable.
Right here in York Region, everybody.
It is.
This is not offered. This is very rare. I mean, thank you for coming in and bringing it.
No, it's our pleasure.
It's wonderful. Sean, we'd love to have you back with more anti-aging tips for all the people out there. Don't forget, you can go to the website thornhillskinclinic.com and give Sean a call because she can help you look and feel your best. We'll be right back.
Thank you.